Good. In a lot of places, the correctional facilities, the county jails, the city jails, are places where people with mental health issues are just warehoused. Can you address that for Scott County?
Yes, and I will tell you this. To see some of the folks that are brought in to the jail, and this is just not Scott County Jail, I'm talking statewide, as we've made it one of the top priorities of the sheriffs of Indiana has to try to get mental help for folks that are here. That is the saddest, and the thing that makes me most angry is how that the lawmakers can sit there and say that Indiana has all this money left over whenever we are dealing with folks that are being brought to the jail that don't even know their name. They have no idea why they're in the jail. They think they're an animal, okay? And those folks are being warehoused by us. We have no ability to offer mental health. My folks at the jail are jailers. They got a lot of skill, but they're not mental health professionals. Yeah. And what happens is that the sheriffs are going to come. We're going to have money. There's going to have to be some facilities that are going to have to be designated for mentally ill folks. I think I'm speaking to the choir here, even in the crowd, because there's everybody that sees these folks out asking for money and bumming for what they can get. It's a sad situation, and that's why, as the sheriff of Scott County, one of my roles is to make sure that I am taking care of the welfare and the well-being of my prisoners. Mm-hmm. And when we have mentally ill folks that don't even know who they are, or they think that they're Walker Texas Ranger, or it's very sad, you know what I'm saying? Or they sit there. One gentleman sat there on an iron bunk for hours, thought he was a bird, acting like a bird. Just unbelievable stuff, and they're brought into the jail because there's absolutely nowhere else to take them. I can't sleep at night knowing that I'm not providing for the safety or the well-being. I'm not being able to provide everything that I can provide, right, because I'm not a mental health expert.
Right.
We have to have a place to take the folks that are mentally ill besides our county jails.
Right.
That is no place for these folks to be. And right now, police officers on the streets don't have an option. They don't have a place to take people. No. That's got to be fixed. That's got to be a top priority in Indiana.
Residential care is in great demand statewide, and I've had some experience. I worked at a residential care facility during the time when I was in college, and I know that for some people that is the best option, because it is heartbreaking to see them on the street. It's heartbreaking to know that they may just need a safe, clean place to live where they can be treated for their mental illness, and that's certainly not the Scott County Jail.
Right, and it's no jail in the state of Indiana. And we have a little bit of a different significant problem is that because they are inmates, whenever we call to get help, whenever we say they're an inmate, mm-hmm, most of the paid facilities say we ain't taking them because they are an inmate. Right. So we need a system in Indiana. When I get a person in there that doesn't know who they are, and they're being arrested for crimes, and I know why the police do it, because they're getting trespassed because they're everywhere. Sure. So the police is doing their job. When they go back on the property, they're arresting for trespassing, and I get that. There's nothing. I'm not saying nothing negative about them being arrested, because it is a law. Okay. Right. But the problem of it is in the law it says that you have to knowingly and intentionally commit a crime. I don't think these folks know that they're knowingly and intentionally committing the crime of trespass, and they get brought back in. And then when they get there, we've got to have a place that we can call Department of Corrections or whoever, mental health, DMHA, Department of Mental Health in Indiana. We have to have a hotline that says we've got a mentally ill person here that needs help, and we need a place to bring them so they can receive that help, because they do not and cannot get the help that they need in the Scott County Jail or any other jail in the state of Indiana that does not have a full-time mental health provider that has their own facility within inside of their jail, which some of them may be lucky enough to do that.
Well, thank you, Sheriff Goodin. This has really helped me understand the needs of the community, and do what I can to make sure we can meet these needs. Mm-hmm. Thank you.